Welcome. I'm Rami Khouri from the AUB Media Studies Program, and welcome to this latest and last for this season edition of the AUB Beirut COVID-19 Briefing, where we discuss with faculty members at AUB issues related to the COVID-19 pandemic and wider dimensions of it other than just purely the virus issue. We're delighted to have as our guest this week the chairman of the psychiatry department at AUB, Associate Professor Dr. Fadi Maalouf, and he has a specialty in adolescent mental health, but deals with many other issues. And we will go to New York once or twice and have Alison Freeland there, who will pass along questions from the audience. We can't hear her. Okay, thank you, Alison. Dr. Maalouf, welcome. Thank you for being with us.
Thank you, Rami, for the invitation. Thank you, Alison, for the invitation. It's a pleasure to be with you this evening in Beirut.
Yes, thank you so much. There's a lot to talk about. The issue of mental health, emotional well-being, pressures and stresses. It seems that almost every dimension of life that is impacted by the virus directly or indirectly, the economy, mobility, income, leisure activities, homeschooling, just there's incredible sources of pressure on individuals, on families, on households. So where do you start as a psychiatrist addressing these issues? And I know your department, you'll tell us more what you've actually done, but where do you start to analyze what are the actual new forms of stress and pressure and issues that you need to deal with?
So, you know, obviously, these are unprecedented times, and but we do learn from history. We look at the literature. We look at what happened during the Spanish flu pandemic. We look at what happened during the SARS also outbreak, and surveys that are being conducted during this current pandemic show that up to 50% of people do experience some type of psychological distress. And we're talking about anywhere between 35 to 50%. And this is not a negligible number. It tells you that this psychological distress may be a normal reaction to the exceptional circumstances that people are going through. Now we have to be careful and to differentiate between a distress and a condition or a disorder. So, yes. You know, feeling nervous, feeling worried, maybe having some bodily ache, having some disturbed sleep, maybe a normal reaction to being quarantined, being isolated from your community because of the pandemic, or even, you know, being out of work or out of school for a child. But when these symptoms cluster together and they impact your level of functioning in a way where you are not enjoying things as much as you used to, or where you are not connected with your family members in the same household as much as you used to, or where you're not productive as much as used to in a reasonable way, because all of us are less productive nowadays, then we need to look at this seriously, that this may be a mental health condition that is more than just psychological distress due to the current situation.
And can you separate easily what is a consequence of the immediate situation and what is a longer term issue that maybe was there before and just became more pronounced?
So this is an excellent question, because when we want to intervene and we prioritize our interventions, we look at the most vulnerable. So, and people who are most vulnerable are people who are at higher risk to develop either severe distress or a psychiatric mental health condition. So if you are someone who has already experienced a mental health problem, or if you have somebody in your family with a mental health condition, you're definitely at higher risk to develop a mental health condition as a result of a distress due to the current circumstances. So this is we call this, acute stressor on top of a chronic condition. So let's say if you're someone who has been stable for a while, maintained on medications for your anxiety condition, or receiving psychotherapy for anxiety condition, this is the time when, unfortunately, because of the negative factors that you're encountering, this is the time where you may experience a relapse. So that's why we encourage people who have already a treatment team or who have a condition that are being treated for to reach out to their treatment providers during this time, even if they're feeling well, just for a checkup and to make sure that everything is okay.
But if you're talking about 35 to 50% of the population showing some sign of psychological distress, that's clearly beyond the means of the available medical system to deal with. So most people are not being treated for their immediate situation due to the pandemic, right?
Correct. So we don't need to treat everybody who's showing psychological distress. I mean, as mental health providers, our job is threefold, I would say. So we have to educate the community and educate people that showing distress is maybe a normal reaction to what they're going through, to be able, and this can be done, through awareness sessions, through what we're doing right now, social media and the mainstream media, and educating the public also when to seek help, and what's the difference between, a normal reaction to what's going on versus a more concerning symptomatology that would need further evaluation or help. So this is at the community level. Also at the community level, there are things that can be done, such as giving the public certain skills on self-help, help them maintain their emotional well-being and develop further their emotional resilience. But then when it comes to intervention, as I mentioned, we have to prioritize the most vulnerable first. So the most vulnerable groups are those who first are at high risk for a mental health condition, either because of prior history or because of a family history.
Right.
Those who are at also who experience several adversities, those who live alone, and who rely on social connectedness as a resource for their emotional well-being, and now all of a sudden they lost this social connectedness. So living alone, older people, as we know, there are, when you listen to the news, you only hear that the older generation or older people are at higher risk to get infected with the virus. Or to have complications from the infection. So these also at higher risk for mental health conditions. Children and adolescents are at a vulnerable group as well. The disabled population. So if you have a child with autism who is used to a certain structure at an institution where they're offering him or her all the help that's needed, now the child is going to be at home, and without the help that the child needs, he or she is more likely to develop further mental health problems. Healthcare workers are another vulnerable group, because of everything that they face and the anxieties that they may be experiencing as well. So we do prioritize these groups when it comes to intervention.
So before we get into what you're doing about it, let me just ask you a couple of more questions. I've seen a lot in the media here and internationally. There's more domestic violence. There's more, spouses or children. There's suicides apparently are up, and there may be other indicators. These are probably the most extreme signs. What would you say are the most serious signs that are verified now in terms of statistics that are due to the pandemic?
Yes, absolutely. So in mental health, we have very few conditions that could kill people, and suicide is one of them. Violence is another one, and we have also anorexia, which is an eating problem. So Fortunately, we don't deal with fatal conditions as much as our colleagues in other specialties do. But unfortunately, suicide is a problem that is also preventable. So if we look at the literature, we see that there is some literature that suicide rates increased during the Spanish flu pandemic. And we also, during the current pandemic, there have been on the news coverage of several, unfortunately, completed suicide in different parts of the world, the UK, the US. What was sad and fascinating at the same time is that some people committed suicide right after they received the diagnosis. There was this person in New York City who, in the hospital, shortly after receiving the diagnosis, committed suicide. There were other people who completed suicide while waiting for their test results to come back.
Wow.
So, and for these individuals, when they did their biopsy after, unfortunately, they passed, the results were negative.
Wow.
So the fear of waiting for your results to come back may have precipitated. And I don't want to come across as someone who's simplifying the issue of suicide, because it's much more complex than just it being caused by one specific factor. But definitely increased level of stress for somebody who's already at high risk can trigger and push this person to attempt to take their life. Domestic violence is another issue. Again, if we look at the literature, there isn't much literature from the current pandemic, but looking back during the recession, economic recession between 2007 2009, was it? The non-accidental head trauma in children, which means a kid who was hit on his or her head, not accidentally, doubled during that period. And this may be attributed to the fact that there were financial issues. Parents are more likely to be at home because they lost their jobs. And we know for a fact that the perpetrator is often a parent or a family member.
Right.
And as I mentioned previously, kids who are disabled are out of institution, their institutions now. So they're at home, confined, with a stressed parent, and they're having exacerbation of their problematic behaviors. And unfortunately, this puts them at higher risk to be physically or otherwise abused by the perpetrator.
And what about communities that are particularly marginalized or at risk, like refugee camps, very poor urban or peri-urban neighborhoods with extreme congestion? Do they have different rates of mental health and distress issues than the rest of the population?
We know that life adversities and life stressors, when it comes to mental health conditions, it's an interplay between your genetic background and your life experiences. Again, researchers have shown over the years that for those who are genetically at risk to develop a mental health problem, having more than 2 life stressors would trigger a mental health condition. If you're already at risk. So when we look at refugees, then these are individuals that unfortunately have gone through a lot, and chances are they've experienced a multitude of life stressors. So definitely the rates of psychological distress in this population is higher than the general population. And when I'm mentioning, having 2 events or more, 2 life stressors or more, I'm thinking about the Lebanese population nowadays. So it's in addition to the pandemic, it's a triple whammy when we look at risk factors for psychological distress.
Well, the economy, the political stalemate, banking system, I mean, it's incredible. And then being cooped up at home. If you take these different stressors, is there one that seems to you the most critical one, that if you relieve that one form of stress, like if you opened up the banking system, people can take their money, would that relieve a lot of these stresses, or is there one that's much more important than the others?
I think there is a common theme, and then there are specifics depending on the individual. The common theme would be uncertainty. And I think uncertainty is the one reason that is mostly associated with the stress, especially in people who are, and most of us are, they plan ahead, they want to know what's going to happen. These individuals don't do well with uncertainty.
Wow.
And most of these conditions are associated. We don't know when the pandemic is going to end. We don't know when the economic crisis in Lebanon is going to end. Is it a 6-month crisis or is it a 10-year crisis? And, the political instability has been there forever, and we're not sure also whether it's ending anytime soon. So uncertainty, I think it's a common theme. But whether or not for a person A, the financial crisis is more of a stressor than the health crisis is going to depend on the person's own makeup.
Right.
Am I more worried about my health now, or am I more worried about my finances?
Right.
Depending where I'm at in life and what are my assets in terms of strengths and weaknesses emotionally.
We have some questions, comments coming from New York. Allison?
Yes, I'm sorry about the audio before. I think we have it fixed. We have people on from Dubai and Syria, New York, Atlanta, Indiana, South Africa, and Philadelphia. We have a question about the importance of sleep during this time.
Sleep.
Yeah, sleep is an underestimated marker of mental health.
Wow.
So I think if one thing we should really pay much more attention as professionals and as individuals to sleep. It is at times the first thing to get disturbed when someone is developing psychological distress or a psychiatric condition. And at times it is the last thing to improve.
Wow.
So maintaining a healthy sleep pattern is key to mental health. It is key to your cognitive functioning, to your ability to learn, concentrate, and pay attention. It is important for your ability to control your emotions, your anger, your sadness, and your worry. And it's equally important also for your physical health in general. Mm-hmm. Now, it is challenging to maintain a healthy sleeping pattern. My one advice is not to resort to substances or alcohol to help us sleep at night. There are, things that you could do. There are certain herbal medicines that you could resort to. But most importantly, if your sleep is disturbed, consult with a specialist, because they'll be able to advise you properly. This is what I have to say about sleep.
So, given the many different dimensions of distress, how it's manifested, people get angry, they have fights, they yell at each other, sometimes violent, sleep, you mentioned all these things. Are there one or two broad recommendations that psychiatrists make to the population at large? Like if you were asked to put a daily 2-minute message on television for all the people of Lebanon or all the people of the Middle East, and you want to give them advice, are there some general recommendations that you give to the population as a whole to try to deal with this situation?
So these are recommendations or tips that, in our opinion, as mental health professionals, foster resilience, because this is what we need, right? And we do tell people, again, it's easier said than done, but if you practice these things, they do work, and we have evidence, scientific evidence, that they do work. Although at times they may sound simple things to do, right, but they are efficient and efficacious.
So give us
So first thing is, control what you can control. I cannot claim that I can control when the pandemic is over. I can't claim that I can control when the financial crisis is over. But I may be able to control fewer things in my immediate environment or immediate surrounding. So, for example, I may be able to make a choice whether I'll have a dinner at a restaurant or at a friend's house, or whether I'd work from home or go to the office twice a week. So, accept the fact that there are certain things that are out of my control at this moment, but also empower myself to make choices and so that I feel that I'm in control of things that I can control. Okay. Acknowledge my feelings, don't dismiss them, and label the feelings properly. So I am nervous, I am angry, I'm sad, are things that we should tell ourselves or tell our spouses or tell our children, right, instead of dismissing the feeling. Self-compassion is very important. Most of us are very harsh on ourselves, and this is not the time to expect too much from oneself. Practice self-compassion. I worked very hard today. I deserve this. Okay. Practice gratitude. List 3 things at the end of the day that you're grateful for. And this always would remind us that despite all the negative experiences around us, there are certain things that are still positive. Some other things also include, self-care, such as meditation, yoga, physical activity, of course, avoiding alcohol and drugs, and monitor yourself. I mean, if you feel worried, anxious, scared, sad, angry, with disturbed sleep and problematic behaviors that is impacting you and your functioning within your family or society at large, then you need to seek help. Because help is available.
Is the lack of physical contact with other people because of the isolation, everybody's supposed to stay at home most of the time, is that a huge issue, or can that be overcome by phone calls and Skype and Zoom and things like that?
For most people it is. Now, interestingly, I'm a child psychiatrist, so in my clinic I mostly see kids. So for kids with social relatedness issues, kids who have trouble with social relationships, for some reason, being at home, away from face-to-face interactions with their peers has done them well, has helped them a lot, which was counterintuitive. But again, this is the minority. Most of us are by nature social beings, and we thrive on our connectedness with others. So definitely we should, during the pandemic, and for those of us who are still under lockdown, we would need to compensate for that by reaching out to people via, online, via social media, WhatsApp. It's definitely not the same. I mean, having a cup of coffee with your friend in a restaurant is very different than chatting over Skype. Right. But it is still some type of social connectedness that we should be able to maintain.
Yeah, I found that calling my friends all over the world on WhatsApp is a huge help. Just chatting on stuff and asking about each other. We have some more comments from New York. Allison.
Yes, we have a question. Are you involved with or aware of efforts in Lebanon to reduce the stigma around mental health issues?
Stigma is, so I'm going to start with some statistics. So we conducted a study where we showed that, again, I'm an adolescent psychiatrist, up to 20-25% of kids were showing some signs of psychological disturbances, mental health conditions. Oh. Only 6% of them sought help.
Wow.
So we have what we call a 94% treatment gap, which means 94% of kids who needed help did not get it. Part of this is due to availability and accessibility of service, but a big part is due to stigma. So stigma is one of the main barriers that would prevent people from seeking mental health treatment. Our department has been involved in several campaigns and efforts to help reduce stigma, primarily by either conducting social media campaigns or conducting webinars where we would address the general public and educate them about the different mental health conditions, and that help is available. And for the most part affordable, because we also have a low-fee clinic that is open for people who are at a social disadvantage.
Wow. So that takes us to my next question, which is the response of your colleagues and you at AUB to the situation that's arisen in the last 3-4 months. Are there particular new activities or new programs or outreach, or what have you done to try to address the needs that have arisen?
So soon after the pandemic started, we got together, brainstormed, and had several task forces, worked on several initiatives. The number one was launching and expanding telemental health. So being able to evaluate and treat people online.
On an individual basis?
On an individual basis.
Wow.
So people who could not come to us, we were able to fortunately treat them online. People who were afraid to come to the hospital because it's a hospital environment and everybody is panicking about COVID, then we were able to treat them from the comfort of their homes. And this is still, it's interesting because now even after we opened up, it's still a very popular way for people to seek help, which was a lesson learned for us.
Is it as efficient as person to real?
Well, it is. Yeah, it has its own standards, but studies have again shown that telehealth visits are as effective as in-person visit in psychiatry and psychotherapy.
Wow.
So they are as effective. Now, of course, you have certain exclusion criteria. It can't be done with very young kids. Maybe it can't be done with older individuals as well, who may be hearing impaired, etc. But definitely, for the majority of the population, it works as well.
And how do people know about this? Do you market this? Do you put advertisements or just word of mouth, or you tell the medical profession and they?
So we marketed it, and our slogan was, mental health got closer. So this is one. And everybody who called for an appointment was actually offered this option versus an in-person and physical appointment. And, at some point, 60% of our appointments were being done online. Now It's down to maybe 20-25%, but yeah, at some point it was a popular option for people. So this is one initiative that we launched. Other things that we did, again, thinking about the most vulnerable and our colleagues who are at the front lines, a group of us volunteered and offered one-to-one sessions, counseling sessions for employees who would like to seek counseling, and these were at AUB.
At AUB. Okay.
These were free of charge, and they were offered to the community at large. We also conducted sessions, group sessions, webinars to the AUB community on building resilience and dealing with uncertainty. Mm-hmm. And we had webinars to the general public as well on different themes, such as tips to deal with kids with disabilities at home, tips to deal with having an older parent or somebody you care for at home during the pandemic. So we were quite busy during this time, and we're now back to business as usual, but certain initiatives that we started have proven to also work and be of value outside the pandemic, such as telehealth and the employee counseling program.
But you say that you're back to business as usual in terms of volume of work or patients, but that's kind of intriguing because we haven't really solved any of the major problems. There's still the risk of infection, there's still massive economic stress, political distress, travel bans, people not going out too much. They go out more, but still, so the pressures that create distress are still there.
Absolutely. So although we're in numbers almost back to business as usual, the quality of the problems and the kinds of the problems that people are coming in with are different. So people now are more concerned about their financial well-being than ever. We have a lot of people who cannot afford the fees for the consultation and their treatment. We have to at times recommend that people come into the hospital for emergency or acute care, and they can't afford to do that. We also have families who are stranded here, and their other family members are still abroad who are struggling with the separation. So the issues are different. But what is reassuring is that despite their the scarcity of the means, people are still seeking help when they need it.
We've got some more comments, questions from New York. Allison.
Just a comment about feeling tired during this time of COVID-19 and other issues. And I'm just wondering if you might comment on that.
If I can add to that, also having trouble concentrating on something you've got to do and you keep finding reasons not to do it. Those two things seem to be very common.
So it's, so attention is a brain function and concentration is a brain function, obviously. And when you have too many competing things that you need to pay attention to, then it's a problem because you have limited resources, right? It's like you have limited resources and then you have too many competing needs. So I have to think about my health, I have to think about the health of my loved ones, I have to think about here in Lebanon the financial situation, how I'm going to buy food to my family members, etc. So obviously, because of all of these competing tasks, your efficiency and your ability to sustain attention long enough to start and finish a task is going to be compromised. And as a result, you're going to feel physically tired and exhausted. And unfortunately, at times, guilty because I haven't finished what I was supposed to finish.
Right.
I haven't finished what I started. But again, this is the time where you need to practice self-compassion and remind yourself, I have all of these issues that I'm dealing with,
Right.
and I'm doing a good job. I don't have to excel at every single thing that I'm doing.
Right. Fascinating. We've got about 5 minutes left. Let me ask you a couple of quick questions, and then we'll close it up. Do you find in this experience of the pandemic that your department or you personally as a psychiatrist or your department of colleagues at AUB have interacted with other sectors in society more than usual? For instance, the media, the educational system, the government, the private sector, the NGO sector. Have you engaged with more people to respond to society's needs or not necessarily?
No, we've been fortunate to have in the department great advocates and national and international leaders in mental health. We have a colleague, Dr. Joseph Khouri, who is a president-elect of the Lebanese Psychiatric Society, and we have colleagues who are previous founding members, founding presidents of the Lebanese Psychological Associations,
Wow.
Dr. Brigitte Khouri, Dr. Layla Dirani, and now Dr. Dina Aina, who's very active also. So each in their own association have helped advocate for the different mental health initiatives that we conducted. And we had a couple of meetings with the National Mental Health Program of the Ministry of Health to make sure that what we're doing is aligned also with their strategy in terms of mental health response to the COVID-19 pandemic specifically. We've been solicited by the media a lot, and we do have a communication team in-house within the department. We coordinate with the overall communication team at AUB, and we make sure that when we appear, we deliver a message also that is in line with our strategy and with the efforts that we are conducting.
Mm-hmm. And finally, did you make a particular effort to focus internally within AUB? I mean, students and professors and staff, for various reasons, are under new forms of stress. Clearly, I was teaching 2 courses in journalism, and I was suddenly having to teach them online, and I could see, I had trouble adjusting, which I did eventually, and I could see some of my students were obviously, their mind was somewhere else. So we adjusted together, and we seem to have gotten through it okay. So did you focus internally at AUB?
So absolutely. So these resilience building sessions and dealing with uncertainty sessions were open to, we had 2 types of sessions that were only open to the healthcare workers because they were dealing with healthcare issues, but also sessions that were open to the AUB community at large. So staff, professors, and employees in general. We also worked closely with the counseling center at AUB, the Students Counseling Center, and we co-led certain also group sessions that were attended by students, again with the theme of building resilience, dealing with adversity, and dealing with uncertainty.
And are these new efforts likely to continue?
Well, they were well received. Now what we're doing at AUB MC, and we're hoping to expand it to the campus at large, we are addressing the heads of departments and meeting with them specifically to try to tailor groups and interventions specifically to their needs.
Wow.
And these can be in the forms of either workshops or one-to-one sessions or group sessions.
Wow. We've got one more question from New York, and then we'll wrap it up. Alison.
We have thank yous from people who've been watching online for the advice. We have a shout out from one of your students from 1967, and a quick question: if this time in particular has inspired a line of research that you might be interested in pursuing, Dr. Maalouf, that you haven't really had time to do before.
So yeah, thank you for the thank yous, and it's been a pleasure to be able to address the audience. You know, this is the time where we don't only think about service and advocacy, but definitely what we do usually inspires us and generates research questions as well. I'm personally interested in building in interventions that help kids build emotional resilience, and I was in the middle of a research study that I was conducting because it's a school-based study. We had unfortunately to interrupt it. So my next research question is going to be how to tweak this intervention in a way where, one, I would make it more relevant to the current stressors. 2, I would make it available online and feasible to be done online. So these, I think, would be my next research questions that were inspired from the current situation.
Okay, I was going to end, but I'm going to ask you one more question. Is there a difference in the cultural context of mental health issues in psychiatric treatments, if you're in Lebanon or if you're in China or if you're in San Francisco?
Well, genetics may be different. And again, it's an interplay between the genetics and the environment. The local stressors may be different. For the most part, mental health conditions are common and they're equally present and across cultures, and they don't differentiate between socioeconomic classes or cultures.
Wow.
But there may be certain cultural factors that may impact your mental health in a certain way. Religiosity has been reported to be a protective factors for some cultures. So for the most part, culture does play a role, but it's a minor role.
Well, on that note, thank you very much, Professor. We enjoyed having you very much. Fadi Maalouf, head of the Psychiatry Department at AUB. This is the last session for this season. Perhaps we will be back next year with more shows, but I'd like to thank many of the people who've made this possible. Martin Asser, the head of the Communications Department at AUB, and Allison and Justin in the United States, Joseph and Edward, our technical crew, and President Fadl Khouri for initiating the Committee on Expert Committee at AUB, which was the trigger for us to do this show. It's been a great pleasure. We've all learned a lot, and we'll be back hopefully in the future and learning together again. Thank you all. Bye for now.
Thank you, Rami. Thank you, Allison.
You're welcome.